And in this month's Move Well, Live Well with PCI Orthopedics, we're going to be discussing shoulder injuries with Dr. Eyberg. Welcome.
Thanks so much for having me. Happy to be here.
Yeah. So what are the most common shoulder injuries?
So first of all, I just want to point out that shoulder injuries are incredibly common. Yeah. They're the top 3 visit to primary care physicians for musculoskeletal pain in the world, or in the country rather, sorry. There are about 300,000 rotator cuff repairs that are done a year when it comes to surgery, and there are about 175,000 shoulder replacements that are done every year. So incredibly common, and even with those high surgery numbers, most shoulder pain is treated without surgery and gets better with time.
Okay, so that's good to know. What are the signs and symptoms to watch for?
Signs and symptoms would be stiffness, pain, and also just thinking about what activities you've been up to. If you've kind of been doing, maybe you're painting your house and you haven't been doing, you've been doing it for a week, that would make a lot of sense. That's an overuse injury. Maybe you play sports, and I think that it's important to kind of break up, shoulder injuries into age groups. So like, for example, with children who play sports or young adults who play sports, they'll have a certain set of injuries that they experience, and that'll be different than the 80 or 90-year-old who experiences shoulder injuries. So in young people, we might see shoulder dislocations. We might see overuse injuries like something we call little leaguer shoulder, which is basically a child that maybe has thrown way too many pitches and they have shoulder pain.
That happened to me, so I get it, yeah.
Exactly. Kind of in the middle-aged folks, we see more kind of strain, overuse injuries, and also starting to get more rotator cuff injury, biceps injuries, things like that.
Okay, so a lot of like the repetitive injuries.
Repetitive injuries for sure.
Okay. So what are some of the options for treatment and recovery?
So like I had mentioned, shoulder pain is overwhelmingly treated without surgery.
Yeah.
So I'm going to use the example of like a young person who dislocates their shoulder. Okay. When you have say a 15-year-old male who plays hockey, who plays football, who's dislocated their shoulder, the likelihood that they re-dislocate their shoulder when they play sports is very high.
Right.
So they will probably be offered a surgery immediately. They may trial some non-operative management, but it'd be very reasonable for them to have surgery to stabilize their shoulder. If I have a 90-year-old who does the same, we're not going to offer them surgery right away. In fact, a 90-year-old has a very low likelihood of re-dislocating their shoulder. Okay. And in fact, they're much more likely to have a rotator cuff tear than they would to have recurrent shoulder instability.
I know a lot of people have rotator cuff tears. Yeah. I had one myself, and very, very common.
Very common.
Yeah, but how are they diagnosed?
How are they diagnosed? So rotator cuff tears are overwhelmingly what we call degenerative, meaning they're just kind of a part of normal aging. What happens to the biology of our tendons as they get older is they start to get a little bit more brittle, they start to thin out, and they start to tear slowly over time. If I did an MRI of 100 people over the age of 50, I'm probably going to find about 50% of them have some finding on an MRI that could suggest a rotator cuff tear. May not be a full thickness tear, but they may have some sort of rotator cuff tearing. So with a rotator cuff tear percentage that high, we generally don't start with surgery for something like that. Somebody comes in with shoulder pain, and we'd offer them some anti-inflammatories, a course of physical therapy, maybe a cortisone injection if that's something they're interested in, and give them about 8 weeks to see if that improves.
Okay.
And if pain persists, we might proceed with an MRI, look for a rotator cuff tear or some other pathology that might be causing shoulder pain.
What questions should patients ask you when they come in, or what do you need to know? Because sometimes I know people will come in and they'll just, hey, I have pain, but you need a little more than that.
What we want to know is, was there an injury that started it, or did it just come on out of nowhere?
Okay.
Have you had any treatment so far, and was that treatment effective for you? And I think those are really the most important things. If somebody comes to me with 6 months of shoulder pain, they've already had physical therapy, they've had an injection somewhere else, I'm probably going to move straight to an MRI. Whereas if somebody says, I've had 2 days of shoulder pain, I had a clear injury 2 days ago, I'm probably going to say, hey, why don't we do some anti-inflammatories, let's try some physical therapy and see how you do.
One of those things where somebody falls or they did something, they could feel that pain right away
they felt
versus
a pop,
kind of,
they knew something was going on,
All right. Can people reach out to you directly, or how do they go about that?
So, I mean, PCI Orthopedics has 20 orthopedic surgeons that offer comprehensive orthopedic care. Give us a call and we can see you probably within a couple of days.
Okay, great. Thank you so much, doctor.
Thank you so much.